You know, if you or a loved one has been diagnosed with prostate cancer, you're definitely going to want the best type of care that you can find. Well, that's why we're over at Singing River Health System. Been here many times talking to some of the wonderful doctors that they have here, and one of them being Dr. John Bechtel, who's a radiation oncologist here. Dr. Bechtel, how are you?
Good, how are you?
I'm well, thank you. Talk a little bit about, if you would, radiation therapy that you do here at Singing River Health System.
Okay. Well, yeah, prostate cancer usually gets treated with either surgery or radiation. Radiation for prostate cancer is delivered with a high-powered X-ray treatment machine, basically. Very similar to a chest X-ray machine, but it's much stronger and more targeted, almost like a laser compared to a flashlight.
Right.
The patient comes in daily for treatments, Monday through Friday, for about 20 minutes a session, and usually for about 8 weeks or so. So it is a rather lengthy course of treatment, but that said, it really doesn't actually take that much time out of your day. You come in as you are. We do like your bladder a little bit full, but you don't have to have contrast, or you can drive yourself. You can go to work the same day after you're done with your treatment.
Oh, wow, that's awesome.
Yeah, so it doesn't, I mean, you have to take 20 minutes out of your day to get here, but other than that, you just come in as you are and lie on a table for a while and hold still, and this machine, this fancy machine, moves around, makes a few noises, and you don't feel anything, no heat or stinging or burning. And then you come in.
And I think that's one of the things that people fear. You know, in the past they've heard of people having to go through radiation therapy for cancer, and then it burns and all that, but it does not necessarily.
No, not for prostate cancer. The old machines were made of cobalt, and they would actually give quite a reaction to the skin, but the modern machine is much stronger and more targeted. And so for something like the prostate that's deep inside the body, not close to the skin, we actually don't see a skin reaction at all anymore for prostate cancer. Now, you can get just a little bit of irritation of your bladder and rectum and some mild fatigue, but there's some patients that don't even get those symptoms. So usually mild or no symptoms, and none of that getting burned up like you used to hear about in the old days.
How does the radiation therapy fight cancer?
Well, radiation passes through the body, and a lot of it doesn't do anything. That's why we're able to actually capture a picture of the patient before we treat them with the x-rays that pass through. But what it does is it damages the cancer cell's DNA. And cancer cells usually have a DNA problem. You know, they can't repair DNA damage well, and so they don't repair that damage as well as normal cells. And so the normal cells heal and the cancer cells die.
And what's the benefit of using radiation over chemotherapy?
Chemotherapy for prostate cancer is really only for very advanced cases or for cancers where it's spread. So chemotherapy is not curative for prostate cancer. It might help cure some advanced cancer patients, and it helps with people whose cancer has spread.
Explain the team approach that y'all have here at Singing River Health System.
Well, there's myself and Dr. Greenfield, another radiation oncologist, and we have the urologist, Dr. Spencer Jr. and Dr. Lyle we work with. And then a whole team of people help me do my job. We have technicians who operate the machine and help the patients, get the actual treatment. And we have people behind the scenes that help me plan the radiation and make sure the machine's running as it's supposed to. And of course, nurses that help take care of the patients with symptoms that may come up. So a front desk staff and answering the phones and helping them check in, all those things with insurance, all those sorts of things.
Well, I appreciate your time. You mentioned Dr. Greenfield, so we're going to talk to him now, find out more about the wonderful therapy that they have here for prostate cancer at Singing River Health System. Now, another one of the medical oncologists here, Dr. Brad Greenfield. How are you, sir?
Good, good. How are you doing?
I'm very well. Tell us about some of the treatment and technology that is used here. I've been kind of explaining this big trilogy machine that you have.
Yeah, so here we at Singing River, we have a linear accelerator. This is the latest and greatest. So here we treat what we call image-guided radiation therapy. This is used for prostate cancer especially. If you don't have this, you basically you're treating blind. So here we have the latest and greatest so that we can every day take a cone beam CT, know exactly what we're treating, make sure the bladder's perfect, the prostate's perfect, and all the other structures that we're worried about are all out of the way. And so we get precision treatment within millimeters of accuracy.
Now, patient comes in here to be treated. What can they expect?
So they come in here, they lay down flat in this table. The machine, we take some films to begin with to make sure they're perfectly lined up. Again, it's all about accuracy and being perfect. So once we assure that's okay, it takes about 5 minutes to treat. And after 5 minutes, they're out of here and they go home.
That's all? 5 minutes?
That's it. No side effects.
Wow.
They should be feeling good.
You would think something like that they'd be in there for a couple of hours.
No, it's like getting a chest X-ray or a CT. You don't see it, you don't feel it. It's like we're doing nothing to you, except we're treating your cancer.
Wow, and that's awesome. Who is a candidate for this?
So for prostate cancer, anybody who has a prostate cancer is a candidate for radiation. So surgery and radiation have the same outcomes. The difference is toxicity, or we call side effects. So with radiation, unlike surgery, radiation you don't get as much urinary incontinence and you don't have as much ED or impotence with radiation. So quality of life in the short term for those two things are better with radiation than compared to prostate cancer. And in some cases, especially high risk, radiation is actually preferred, according to the guidelines, the NCCN guidelines, is actually preferred over surgery for those types of cancers.
Is it always good to get a second opinion?
Always good to get a second opinion. So for me, I studied, I trained at was fortunate to train at one of the best cancer centers in the country and in the world. And with that, I feel having an oncology perspective is a very good before we decide on any definitive treatment.
What's the chance of recurrence?
So it depends on which kind of cancer you have. So if you're low risk, there's a lower risk, and then it goes all the way to high risk. So depending on which cancer type and how aggressive it looks after your biopsy will determine what the best therapy is for you and how likely that therapy will work.
So when would be better to seek this type of treatment over surgical treatment?
So both of them work equally as well. It's all about what the patient is willing to accept toxicity-wise. So again, as I said before, radiation doesn't have as much urinary incontinence or impotence or ED problems as surgery does.
Right.
But there's other things that go along with radiation, but not those specifically.
And I guess they'd have to basically come talk to you to find out if they need surgery or if the radiation treatment would be better, just as good for them.
Yes, I believe getting both perspectives from the surgeon and the radiation oncologist are both equally as important. If you only get one perspective, it's kind of alters what your decision making and what you know about your cancer and what treatment options are available. So I always recommend getting to at least a radiation oncologist consultation and a surgical consultation independently.
That was going to be my next question. How do they set up a consultation?
Yeah, so you can give our office a call anytime, Singing River. I'd be happy to see anybody, whether I treat you or not. My goal is to be as kind of a guide to all my patients. It's not to tell you what to do, but to be here personally through this hard time in your life and to make sure that you get exactly where you want to be.
All right, Dr. Greenfield, thank you so very much for your time.
Pleasure.
If you'd like some more information, of course, if you or a loved one has found that you possibly have prostate cancer, as he said, you can call and set up a consultation and get treatment from the great physicians that they have here at Singing River Health System.